Naheeda Rahman. I'm now a fifth-year medical student from UCL, and I worked alongside Colette Jatt, who's a paediatric nurse consultant at the Whittington, and we basically did this project to improve young carer identification within the trust. Unfortunately, Colette couldn't be here today. She has a clinic, so I'll be illustrating how working in partnership with several external parties helped us to develop our project. So we thought the best way to explain the role of a young carer and their experiences would be through their words, so we have a very short video for you.
I do the basics. I help my mum when she's in a wheelchair. I will always help her pick up things if she drops them. I will often go shopping to help her.
Being a young carer is taking care of my mother that has disability and mental health.
I also do stuff like prepare food for her, and I will always, do the little basics, and I also provide emotional support, so if she's really upset, I am always there to help her. I occasionally cook meals.
We have to take our spare time and care, and most of our time taking care of the people we care for.
I'm often very worried. I've actually had a couple of panic attacks, and I've been very scared, and I've had to leave the room. I like to breathe, and occasionally I just not want to be there at all, but I've had to go.
It can be hard to look after the ones you love, and we just want to understand.
So I think it's very clear that young carers have a very significant role in the lives of the people that they care for, and in addition to that they say the NHS upwards of £132 billion a year. However, unfortunately it's still the case that too many young carers are unidentified and thus remain a hidden population to important healthcare professionals who could offer them a lot of support. So why did we do this project? My supervisor and her team received feedback from their safeguarding colleagues about an 11-year-old girl who was left stranded at 11 p.m. at night with no way or no idea of how to get home. After investigating the incident, my supervisor realised that the trust didn't have a carers policy, so herself and a band 6 nurse went around and set about creating a policy for them by themselves. As a part of this process, Colette engaged with adult and paediatric healthcare professionals, but most importantly, she engaged 15 young carers from the trust. And despite the trust being marked outstanding for caring, the young carers expressed worries, concerns, and told some really awful stories about their experiences as young carers in several local NHS trusts in North London. In response to the feedback, Colette recruited myself to improve the young carer experience at Whittington Trust through a policy improvement project. Our aims were to ascertain barriers to support young carers within healthcare in our trust by conducting semi-structured interviews with staff and young carers, to increase young carers' awareness of their rights within the NHS and empower them to exercise them appropriately by running an educational rights workshop, to co-create an intervention with young carers in response to the specific concerns they expressed, and finally to write and implement a young carers policy. Over the course of 2 years, we held 8 engagement events with young carers, as well as 20 interviews with young carers and healthcare professionals, and I'll show you a short slideshow to illustrate a few of the events. So the first event was held at the Whittington in October 2017, and it was here that we identified the need to teach young carers about their rights within the NHS. To address this need, we held an educational rights workshop in January 2018. The United Nations Convention of the Rights of the Child were used to facilitate discussions, such as what rights did the carers feel most important to them. An increase in both young carers' knowledge and confidence to assert their rights in healthcare was noted at the end of the workshop. Semi-structured interviews were conducted with young carers and healthcare professionals to further explore young carers' experiences within the NHS, and these are the 6 themes that we extracted. A lack of awareness, poor identification, which then led to insufficient support, young carers' voices, family dynamics and the impact of caring. The young carers love the idea of having an identification card to address their barriers of receiving support from healthcare teams, and by allowing them to co-design everything on the card from the logo to the rights helped us to understand what was most important to them. We collected feedback from young carers piloting the card in Harringay, Islington and Camden every 3 months. This feedback was used to create a young carers policy for Whittington Trust and to create a second card prototype. This is what the first card looks like, and later on I'll show you the second card that we've created. So as mentioned, we worked in partnership with several external parties, including voluntary organisations, healthcare, government and private teams as well. The engagement events were run by Whittington Health and UCL Medical School for young carers from Family Action and Haringey Council. Healthy London Partnership provided the initial funding of £1,120 for the first card prototype, and we invited a design company to get the creative to co-design the cards with young carers. This is the first card, and we piloted it with 21 young carers from Islington, Camden and Haringey, and we received feedback from 12 of them. PDSA cycles were used to help us improve its use because we realised that the young carers didn't know where or when to use the cards, and to address this we created an A4 information sheet. We soon realised that the main barrier to them using the cards in healthcare was design. Because it was a cardboard card and it was fairly large, we felt it was very bulky and it didn't look professional enough for them. So this is the first card we made, and the young carers had input into everything, including the colour schemes, the information that we have on the cards. They chose the white that they thought were most relevant to them from the United Nations Convention for Young Carers, and they really thought it was important to have the NHS logo on the cards as it added authority and a sense of professionalism to the card. We acted on their feedback, and we created a smaller plastic card which has the young carers' details printed on them, as opposed to having to write it on themselves. The second phase of the pilot has been funded by NHS England through the Carers Grant Scheme, and we were only able to access this through working with voluntary organisations and Islington CCG. And this is a great example of how working in a large team has really helped us to further disseminate the project. A Young Carers policy has now been ratified across Whittington Trust along with the second card, and we really hope to elect some young carer champions from each healthcare team to advocate for the young carers. We've been working really hard to disseminate our research. We're presenting at conferences and days like this, poster presentations, QI days. For example, last year, November, I won the first prize at the Great Ormond Street Bioethics Conference, and I gave an oral presentation at RCPCH this May. With further funding, we really hope to develop an app and a website as a port of call for young carers who want to get access to information and their rights and support that they're entitled to, other services, maybe even order the card. However, this will cost us £13,000, so if anyone has any money, let us know.
A lottery winner that won this morning, they could pass
it
on, couldn't they?
To summarise the project so far, we've spent almost 2 years engaging with young carers, designing and piloting the identification cards, disseminating the project, collecting feedback and revisiting our initial aims to improve young carer identification across health services. Before I start to reflect on the project so far, I wanted to share a few ways that the card has made a difference to some of our young carers. They've used the cards across GPs, pharmacies and hospitals, and they've reported positive experiences such as being able to attend their parents' appointments, collecting prescription drugs such as some controlled medication that they weren't allowed to before. They got flu jabs for free, and they've also been able to go to the cinema for free as well, which has really helped them in terms of respite. Whilst these may seem like really small steps, they do help to alleviate the day-to-day stresses that they face and express to us. And it also helps to alter their perception of the healthcare system to one that's more accessible, supportive and welcoming of them, especially as nurses and medical students and other healthcare professionals would sit down with them and hold these engagement events in our own time and just to listen to their stories, and I think they really appreciated that and they felt very heard. So to reflect on the project, it's been quite a roller coaster. There have been many highlights, many challenges and many emotions from everyone on the team, but I'll start with the positives. So being able to co-develop with multiple organisations, that's enabled enhanced communication between all the sectors and a greater understanding of how young carers have a lot of barriers in healthcare and how we can address this for them. It also made us more aware of the opportunities that young carers have, and as partners we can learn from one another. It was led by service users, the young carers, which gave them a voice. Listening to and understanding their views, opinions and experiences was essential for us to co-develop a resource with them, and having their support throughout its implementation. The quality improvement team enabled a pooling of resources and expertise and enabled service users and partners' objectives to be met. We were also able to meet our personal objectives. For example, I received a first in my dissertation and Colette was able to ratify her policy. Transferability. So when I did my literature review, it was really evident that young care identification is a universal issue, and 7,000 carers identified this as a problem when consulted about the long-term plan. Since starting the project, we've had interest from several trusts across and outside of London, and after consulting with the NHS England Carers Lead, they support and agree with our opinion that the card can be adapted and used universally. So some challenges. Engagement. Engagement is notoriously difficult with all young people, and especially with young carers who have additional responsibilities. Some carers lost their cards and there were varying levels of participation at each workshop. It's also been difficult to collect feedback as voluntary organisations have their own priorities and their own schedules, which we sometimes have to battle with. Funding. This was and it still is a challenge, and we've had to do 2 separate bids to get the project to where it is so far. Despite this, we obviously still have a very long way to go. Different organisations have different priorities, and this extended our timelines as mentioned, and it's something that we're still finding a challenge as we want to proceed with the project and we want to hold more engagement events, but it's not always in the budget of the organisations that we're working with. And some final thoughts. Most children care out of love and duty and don't have a choice. However, as adults, we do have a choice to recognise and respect what they do despite their ages. The NHS long-term plan aims to improve and speed up the identification of unpaid carers and support them to address their own health needs through innovations at work. And we believe that the Young Care Identification card is such an innovation. Thank you for listening to my presentation. I really hope that the next time you see a young person with an adult with health or social care needs, that you think carer and you ask them if they're okay. And as Nelson Mandela said, there can be no less revelation of society's souls in the way that it treats its children. Thank you.